Experts call for more coronavirus tests as positive rate rises. Medical experts are urging Japan to test more people for the novel coronavirus and provide their details to grasp the scale of grasp the scale of infections in the country. After seeing a recent rise in the rate of people testing positive, Japan has so far conducted polymerase chain reaction tests on more than 130,000 people for the pneumonia-causing virus, a figure sharply lower than many other countries including South Korea, which had conducted more than 520,000 tests by April 14th. While Japan chose to limit the number of tests at the outset of the outbreak to avoid straining its medical system, such an approach has more recently raised fears among experts that the country will not be able to fully trace the spread of the virus, and that an explosive spike in infections could go undetected. The Health Ministry currently provides data on the number of people who test positive, divided by the number of tests conducted nationwide and expressed as percentage. As of Friday, Japan had more than 12,000 confirmed cases of COVID-19. Tokyo reported 162 new cases. The figures for positive rates are not precise as the dates the tests were conducted and the dates the results came back are different, but they show the nation average positive rate calculated from cumulative data rose to 10% on Tuesday, up for 5% until March 21st. A rise in the positive rate is especially evident in Tokyo, where the number of people found to be infected with the virus has eclipsed 3,400, the most among Japan's 47 prefectures. The number of those testing positive divided by the number of the tests administered in the capital per week stood at 0 to 7% between February and mid-March, but rose to 16% in the week from March 15th, 32% in the following week, and 63% in the week from April 12th. The Tokyo Metropolitan Government explains the high positive rate as a result of its focusing tests on those who are suspected of infection due to coming into contact with people diagnosed with COVID-19, as well as those who need medical treatment after presenting with COVID-19-like symptoms. But Katsunori Yanagihara, a Nagasaki University professor of laboratory medicine, said experts cannot correctly assess the situation because the data released by authorities in Japan do not distinguish the positive rate for those who have developed symptoms from those tested in the investigation of a positive cluster of infections. We must separately consider those who came to hospitals over fever and other symptoms and those who were tested in the suspected cluster infection case, but the health ministry and the local governments have mixed them all together in their data, he said, adding such a practice may adding such a practice makes it difficult to make technical proposals. I cannot specifically say what percentage for the positive rate is good, but I assume Tokyo has conducting enough tests when the rate was at about 5%, he said. The lower the positive rate with more tests conducted, the better. Shinya Yamanaka, who heads the Center of iPS Cell Research Application at Kyoto University, also said on his website, Tokyo's positive rate has become very high, and warned Japan could fail to detect an explosive surge in the number of coronavirus infections unless it increases testing. Yamanaka pointed out the positive rate in the United States, which conducts far more testing than Japan, is around 20%, but experts are calling for testing to be tripled before the economy can reopen. In Germany and South Korea, the positive rate is 7% and 3%, respectively, he added. Unless necessary testing is conducted, the risk of medical workers becoming infected will increase. Rising fears of a healthcare system collapse, he said.